Well, I know the congressman, but could you say your name and spell that for me?
It's Cathy Bambrick, Cathy Bambrick.
And what is your title in the organization?
I'm the administrator of Astria Toppenish Hospital.
All right, and you?
My name is Brian Gibbons, Brian, Gibbons. Kind of like all those monkeys.
Okay.
Yeah.
And
Long arms, no tails.
and your title here?
I am President and CEO of Astria Health.
All right. So what are we doing here today?
Well, we're visiting with the Congressman, sharing some thoughts about the future of Astria Toppenish Hospital, some of the opportunities that we might have with regard to some of the federal opportunities for Toppenish community.
What did you learn, Congressman?
So, well, there's a lot going on here in Toppenish. It's only about 15 miles from my house, so this is an important thing for me to make sure that the Toppenish Hospital continues to thrive. But we just walked through the new behavioral, that's easy for me to say, right? Behavioral health wing that's being constructed. So that's something that's much needed in the community, so very happy to see that going up. Also, we had a pretty long discussion about some of the challenges that the hospital would face generally in some of the discussions that we're having back in Washington, D.C. as it relates to Medicaid and healthcare and those kinds of things. And Cathy and Brian both have really helped me understand some of the things that I should be aware of in order to be a good part of the discussions and make the right decisions in D.C.
What are you planning to do with this information?
Well, as the process unfolds, and as you know, in Congress, we're looking for ways that we can bend the spending curve in Washington. I want to make sure that with the information that they've been able to help provide and the understanding they give me, that we make sure that the decisions we make to make government more efficient, that in the process we don't hurt people and take necessary services away that people depend on.
This is the second time in 2 days I heard you use the phrase bend the spending curve.
Oh,
Can you
yeah,
expand on that phrasing a little bit?
Sure, absolutely. So this is something that has been hanging over the federal government's head for a long time. We spend more than we take in on an annual basis to the extent that now we're faced with almost a $37 trillion debt in our country. And by anybody's estimation, nobody disagrees with me that that's unsustainable. We have to do things differently in Washington, D.C. And so as you probably see and read every single day, there's a discussion going on how do we do that. And so everything's on the table. Certainly healthcare is one of those areas that the federal government is engaged in that is, there's big numbers associated with that. So finding efficiencies there is something that we're interested in.
You did also mention Medicaid. I know this is a little bit off topic, but as you probably know, there were quite a few people outside your office 2 days ago. Is there anything you'd like to say to them?
I appreciate people expressing their viewpoints on things. These are important issues that touch a lot of people. And I understand full well that a lot of people depend on the Medicaid and the services that are provided through that program. And this is very early in the process. The House of Representatives and the Senate are still working separately, and we have to come together on agreements on how we're going to address spending into the future. So it's good for me to hear what people are concerned with, so that, like I said, I can help make the right decisions as those discussions continue. But nothing has been decided yet. Nothing. No votes have been taken. There's no cuts that are coming to Medicaid. It's just discussions at this point, and there's many steps that need to be taken on into the future. And so I'll stay in communication with my constituents and get the good people here in Toppenish and other places throughout the district, so that their viewpoints are widely known, and that we can make, like I said, the right decisions for the people.
Turning the corner a little bit, a couple of our viewers have been asking a couple of questions. One that comes up commonly is, are you planning on hosting a town hall anytime soon with your voters?
We're looking at when we could possibly do that and make it work for our schedules. So yeah, we'll absolutely do that. In fact, on a regular basis, my staff throughout the district does meet with the members of the public for constituent services, and so we on a regular basis are interacting with people. So we'll get back with you on decisions when we plan to have them and hold those events.
Okay. Turning the corner even more a little bit, on our network before the election, you said nobody is above the law. I was wondering if that, what your thoughts are on the January 6th pardons.
On the January 6th pardons.
Yeah.
Wow. Let's see. Let's switch gears here just a little bit. That was a presidential decision that was made to pardon people that were engaged in what happened in January 6th several years ago. I still believe that people need to be held accountable for their actions, and I will hold to that, but this was not my decision.
So do you disagree with the pardoning?
Well, I'm not the president. If I were in that position, I probably would have made a different choice, but it is what it is, and that's what we live with today.
Okay.
But
Oh, sorry.
no, that's
There's been a lot of cuts, a lot of people even in our district that have lost some of their jobs. We were wondering, should the Department of Governmental Affairs be looking at lowering the salary of elected officials or anybody in a situation like that?
the Department of Government Affairs.
I'm sorry, not affairs. Department of Government Efficiency.
Oh, the Department of Government Efficiency, DOGE, as we, I guess I've been calling it, or doggy, or whatever you want to say. What can I tell you about that? This is an effort on the part of the administration to look at every facet of the federal government to bring efficiencies and fiscal responsibility, which I think everybody supports. Most people would agree that the federal government has become larger than we can manage, and the efficiencies are something that are necessary to, again, use that same phrase, bend the spending curve, that we are truly on an unsustainable path. And so specifically on what those cuts should be, whether it's government salaries or programs, a lot of things will be looked at and identified, quantified, and then my understanding is that those things will come to Congress in order to make them effective or not.
Are you part of any of the teams that are looking into any of those topics that you just mentioned?
Well, I'm part of the Appropriations Committee, which is the committee that makes the decisions on spending. So we are always looking at things like this and have been. But I am not on the DOGE committee. No, I'm not.
Okay. We are experiencing a drought right now. I'm sure you know this as a farmer. I was just wondering if any of the cuts on NOAA are going to have an effect on how farmers do their day-to-day business.
Well, my hope is that not. You're right. We're experiencing what could be a very critical summer as far as irrigation is concerned. Reservoirs are low and snowpack is low, and this is on the heels of several years in a row now that we've been experiencing that kind of weather conditions. So it will be a difficult year for irrigators. We communicate on a regular basis with the administration to make sure that any of the cost efficiencies that they're identifying do not negatively impact people in my district. Certainly agriculture depends on many of the weather forecasts and weather updates and those kinds of things. We want to make sure that those continue. And it's been a mixed bag, but we've been successful at reestablishing some of the positions that were eliminated. We've got people back on the jobs in some of the agencies so far. And so the good news is that they've been open to our ideas and suggestions and listening to us. And we'll just keep making sure that communication happens.
All right. Well, that's all the questions that I have. Is there anything that you would like to say to any of the people in your district?
I would say to people that to stay calm, stay tuned, continue to let me know what I really do need their input and what they're thinking and what their priorities are, so that it helps me to represent them in Washington, D.C. So I need that communication, and we'll join together to get through this exercise in something that we can truly protect the future of our country. That's so that we don't pass on to the next generation something that is overwhelming. A $37 trillion and growing $trillion debt is not something that I want to be our legacy. And so I think we will all be better off if we can protect those programs that are necessary for people. Then that would be a good thing. If we don't go through this exercise, we will not be able to provide the necessary service. For instance, in Medicaid,
Right.
if we are not fiscally responsible, we'll lose the ability to take care of those people that need that kind of help. And so this is something that I think we have to do for the future of our country and for the future of the people that live in our country.
All right, and then for you two on the end, I know we sort of strayed off topic there. Is there anything that you would like to say about anything that happened today?
Say one? Okay.
Please.
I was waiting for it.
Yeah.
Thank you. I wanted to thank Congressman Newhouse for coming today. He listened to our concerns and has assured us that we're in the preliminary stages for all the decisions for the cuts that related to hospitals, and he knows how important it is for us and for hospitals across the state and the nation.
Yeah, I would concur. We're grateful for the work that Congressman Newhouse has done. It's not the first time that we've had the pleasure of visiting, and we're always grateful for the support and the help.
All right, well, thank you very much.
Thank you.
All right, very good.